So, Huntington's disease is an autosomal dominant neurological disorder. So, when I say autosomal dominant, it means that if either of your parents has a mutation, the offspring is likely to can inherit the disorder. So, there's a 50% chance that any child of a Huntington's disease patient will inherit this mutation. So there is a there's a gene called Huntington in our uh, cells, which is on the fourth chromosome, and within this, the exon one, that is the coding region of the gene, there is a long strip of polyglutamine, which is coded by a nucleotide repeat CAG. So in all of us, there is this CAG repeat. But when the number of repeats exceeds 39 repeats, that is, you have CAG, 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 CAG going on, and when it becomes more than 39, it becomes pathogenic. That is, the protein that is formed is not doing its job properly, and people start developing symptoms. So the nature of this mutation is such that it is what is called as dynamic, and therefore, when it is inherited from one generation to the other, there is a chance for this mutation to get worse. And so often, patients would develop symptoms earlier or more severe than what their parents had. And there are three components to this illness: there is a neurology, there's a psychiatry, and there is also a cognitive component. So some patients start with, most patients, in fact, I would say, start with the neurological component, which is called chorea. There is, which is sort of a dancing, uncontrolled movement of the body, and this is kind of typical. So most of the time, if somebody presents to a neurologist with these choreoformic movements, and they say yes, there was something like this in the previous generation, the doctor immediately says, okay, let's test for HD. The other thing is, these patients also have psychiatric symptoms. That is, they have like schizophrenia like symptoms, they are imagining things, they are suspicious, and some of them have a lot of anger outbursts. So often, patients actually go to a psychiatrist first, and sometimes the fact that this may be HD is completely missed for a very long time till the movements start appearing. And these patients also have cognitive issues. That is, slowly there's a dementia like thing and decision making problems and all of that. So there are three facets to the illness itself. Because this illness does not start in infancy, in most cases it will start around middle age, around 35 to 40. At this point, most people would have had children if they did not suspect that they have a genetic condition.